Welcome back to Afternoon Live. Having the flu can be miserable. It can also be fatal for both adults and children. So as we face the worst flu season in 25 years, it is so important to stay informed. Here with everything you need to know to protect your family, we welcome back the author of My One-of-a-Kind Body, Pediatrician Dr. Whitney Casares. It is so nice to see you.
Nice to see you too.
I think a lot of us parents are anxious about this flu that we're hearing about this year.
Yeah, it makes a ton of sense. The ERs are filling up, the urgent cares are filling up. Last year we had the worst flu season in 15 years.
Yep.
Like you said, this year is supposed to be the worst in 25 years. The reason is there's a variant of influenza A called subclade K, which isn't covered well by this year's current flu vaccine.
Yeah.
And unfortunately, we have to create the flu vaccine and produce it well in advance. Scientists do their absolute best to try to predict. Sometimes we just don't hit it 100% right. So
it's kind of a good reminder of how accurate it is most years. When you have these off years, you go, it's actually pretty amazing that 6 to 9 months in advance we can make these choices and get such a great vaccine so much of the time.
I like that perspective. Glass half full.
Well, let's talk about just the basic signs of cold versus flu if we've got worried parents and adults at home thinking about their kiddos.
Yeah, so think about severity and then the onset being really different.
Okay.
So cold is usually more of that runny nose, you have some congestion, you might have a slight fever, things come on pretty gradually. The flu is usually sudden, it feels like it hits you like a ton of bricks.
Yeah.
Chills, body aches, headaches, higher fever usually. Those are the things that usually are differentiating between the two.
The fever can be really scary, especially in our littlest kiddos.
Yes.
When are you able to just treat at home versus heading in to see your pediatrician?
Yep. So one of my mentors in medical school always talked about fever as your friend.
Yeah.
So actually the fever itself is less the big deal. We actually don't even consider it a fever till it's 100.4.
Okay.
Then 100.4 to 102 mild, 102 to 104 moderate, 104 and above high.
Yeah.
Really though, it's about looking at your child. So if your child is listless, so they look like they're just totally lethargic, laid out, you could poke them with a stick and they aren't responding, that's no good. If they're having difficulty with breathing, or if they've stopped drinking or stopped peeing. So less than 1 pee in 12 hours or really not taking fluids, looking like they just ran a marathon, that's what's no good.
And sometimes, it can be really tough for a couple of days, but they can come out of it pretty quickly too as well, right? Depending on your exact scenario.
Yeah, so colds, yes. Colds usually with the fever, it's like 2 or 3 days, they get over it. Usually with the flu though, it can be 5 to 7 days. And what I see is a lot of kids that end up taking the antiviral medications, Tamiflu or Siltamivir being the most common one that we prescribe, that actually can shorten the duration of the flu.
Okay.
Also, we know that flu vaccine a lot of times can shorten the duration and the severity of the flu. So
we should talk about getting the shot if you haven't yet. Even with a tough flu season, is it still worth it to go and get it if you haven't?
Yes. Okay, so I'm going to make a full confession here on Afternoon Live. I got my flu vaccine 4 days ago.
Okay.
And normally I get it before October 31st, which is the recommendation. But this year I was just busy with a lot of other things. And so I just waited till I got to my kids' well visit and I got it. So be like me. Go get it.
Yeah.
If also you're the type of person who's like, uh-oh, it's ramping up, I got to go get it. Go for it right now and get it, because after then a couple weeks you're going to be protected and it's going to help you to not have that severity.
Even in a year like this where the vaccine isn't perfectly matched to the variant, can it still help protect you from the most severe illness?
Yes, and it can help protect you from all the other variants.
Okay.
Because remember, there's a ton of variants of flu A and flu B. The other thing is, remember, I like to use this analogy. If you were driving and you were driving across the Fremont Bridge and you had no seatbelt on, if you get into a car crash, God forbid, you are not in a good spot.
You're in trouble, yeah.
You're in trouble. If you have a seatbelt on, at least you have something that could protect you.
Yeah.
And the side effects of the flu vaccine are very minimal. Like I said, I just got it. I had a tiny bit of arm soreness, ain't no thing. But the flu can actually kill people and is a really, really serious disease.
Let's talk about medications, like you mentioned earlier, if you're a candidate for those and how to talk to your doctor about that.
Yeah, so anyone who is over 2 weeks old in terms of age can be eligible for Tamiflu specifically, which is the most common one we prescribe. There are also categories of people who we say, these are really good candidates for Tamiflu. people who are over 65, but also kids who have chronic conditions like asthma, heart conditions, diabetes, that type of kid. And also immunocompromised people, of course, who have like cancer, that type of thing. So we want to make sure that we're protecting those people the most with the flu vaccine. However, that said, we really started to say, hey, if you are a person who has the flu and you're within that 48-hour time window that you need to be to get these medications, it's a good idea to talk to your doctor and to see if they can prescribe it for you. This year also and last year, the flu test is actually available over the counter.
Okay.
So you don't necessarily have to go into a physician or to an urgent care to get it.
That helps a lot. I was going to ask you about that. All the tests that we see now and like the combined tests that you can get COVID and flu together and when is that helpful, I guess?
Yeah, so that's helpful when you're not sure if it could be the flu or it's just a cold. You're kind of like, I don't know, I don't want to take my kid over there. I don't want to go into the office quite yet. It's good for if you have a sibling maybe that had the flu. It's great for that circumstance. You also don't have to be tested for the flu if there's someone else in your family who already tested positive for the flu or close contact with the flu. So if we suspect it's flu, we can treat even if we don't have that positive test.
The information is power.
Yes.
And then when you're resting at home, good common sense things to do to make sure you can get back on your feet as quickly as possible.
Yep. So resting, fluids, making sure that you're not overexerting yourself, making sure that if your temperature is over 102 or if you are having difficulties where you are feeling those aches and pains, that you are taking something like ibuprofen or Tylenol. And also because we know that once your temperature gets above that, it can make it so that then you're just burning a lot of energy and you might get more dehydrated easily. But do not believe the hype that some kids would be better off if they did not get the flu potentially this season. That's not true. We still want kids to get the flu vaccine this year.
Okay. Thank you so much. Great to see you.
Good to see you too.
Okay, Dr. Whitney's book again is My One of a Kind Body. We'll have more information on our website at katu.com. We'll be right back with more Afternoon Live right after this.